4-year-old fighter leaves hospital after 9-month battle with COVID-19. A New Mexico mother is speaking out after witnessing her 4-year-old's ongoing fight with COVID-19. Cassandra Yazzie of Sandoval County said her daughter, Stella Martin, was hospitalized for 9 months after testing positive on April 24, 2020. As a baby, Stella was diagnosed with asthma, which increased her risk for getting sicker from the coronavirus. Stella spent over 5 months in the pediatric intensive care unit at University of New Mexico Hospital (UNM) in Albuquerque, before being transferred to UNM's Carey Tingley Children's Hospital in October, where she remained until January 2021. "She's a very strong little girl," Yazzie told Good Morning America. "She's still fighting and is putting a smile on her face." Yazzie, who is also mom to 9-year-old Lilia, said Stella came to her in April complaining of pain in her back. More ICU nurse issues warning on Facebook as her dad is treated for COVID-19 on her floor. She was taken to a local hospital, then airlifted to UNM, where she was tested for COVID-19 upon entry. A neurological team performed an MRI scan which revealed transverse myelitis, or swelling of the spinal cord. They said since COVID was an infection, that the good antibodies were attacking her spinal system when fighting off the COVID virus, Yazzie said. The next morning, she was positive for COVID-19. Yazzie said Stella's father had died from complications of COVID-19 on April 18, 2020. She suspects her daughter may have contracted the virus from the innocent exposure, due to hospital safety precautions. Yazzie was unable to stay with her child until she herself tested negative for COVID-19. At UNM, Stella's lungs began collapsing and she had a fever. She was intubated and placed in a coma for 3 weeks. In the meantime, Yazzie would try to video chat if Stella woke up. More, healthcare worker and mother of 2 loses home in fire. Now her colleagues are stepping in. "My heart was pounding. I was so scared," Yazzie said. "I called maybe 4 or 5 times a day and the nurses were really good with her. They said she'd wake up and smile and sometimes would wake up scared and was crying." On May 4, Yazzie had 2 negative COVID-19 tests and was able to see Stella, who came out of her coma. In May, she received a tracheotomy. Despite her health struggles, Yazzie said Stella would check in on the well-being of her own doctors and nurses. "Even if she doesn't know you, she will tell you she loves you," Yazzie said. Stella was released from the hospital on Jan. 26 and UNM medical staff gave her a proper send-off. UNM thanked the community for donating iPads so Stella could connect with family. "We celebrate her recovery and the hard work and dedication of our healthcare team who work tirelessly to help patients like her," UNM said in a statement. Yazzie said Stella will soon begin physical and occupational therapy and is happy to have her home. "With her dad passing, and my dad's passing, unrelated to COVID-19, I had no time to break down, and that's what I did with her and her sister," Yazzie said. "We've been fighting for this and training for her to come home. She loves being in the same bed as me, going in the living room and sitting on the couch. She loves being home." Yazzie has built an Instagram page for Stella so the family can keep in communication with the doctors and nurses at UNM. COVID-19 live updates. Moderna president hopeful for herd immunity by mid-year. Dr. Stephen Hoge, president of Moderna, spoke to ABC's Good Morning America. A pandemic of the novel coronavirus has now infected more than 103 million people worldwide and killed over 2.2 million of them, according to real-time data compiled by the Center for Systems Science and Engineering at Johns Hopkins University. Latest headlines. New CDC reports show who got COVID-19 vaccines and programs first month. More than 6 million newly diagnosed U.S. cases in January. 1 in 12 Americans have now tested positive. Europol warns of fake COVID-19 test certificates. Moderna president hopeful that U.S. can achieve herd immunity by mid-year. Variants detected at refugee accommodation center in Germany. Officials say here's how the news is developing today. All times Eastern, Northeast winter storm throws wrench in COVID-19 vaccinations. New Jersey's 6 mass vaccination sites will be closed Tuesday due to a winter storm that's grounded planes and halted subways across the Northeast. New Jersey healthcare providers will reach out via text, email or phone to reschedule canceled appointments, according to the governor's office. Vaccination sites in New York, Rhode Island, Connecticut, Philadelphia and parts of Washington, D.C., Maryland and Virginia were also affected by the snowstorm on Monday. ABC News' Joshua Hoyos contributed to this report. February 1, 3:28 p.m. South Africa's coronavirus czar calls unequal global vaccine distribution disheartening. South Africa's coronavirus czar lamented unequal COVID-19 vaccine distribution between rich and poor countries, calling it disheartening. In an interview with ABC News, the part of it that is most distressing is the way in which vaccines are being unevenly distributed, said Salim Abdul Karim, chairman of the South African Ministerial Advisory Committee on COVID-19. No single country can vaccinate its own population and think that it can stay safe while new virus variants emerge in parts of the world without vaccines, he explained. That simply is a recipe for disaster. Karim's comments follow similar criticism from South Africa's President Cyril Ramaphosa last week, who accused wealthy countries of hoarding excess vaccine doses that they did not immediately need. February 1, 1:33 p.m. New CDC reports show who got COVID-19 vaccines in programs first month. 2 new reports from the Centers for Disease Control and Prevention detail who received COVID-19 vaccines during the first month of the United States vaccination program. Of the 13 million Americans who got at least one dose between December 14 and January 14, 63% were women and 55% were 55 years old or older, according to the reports, which were released Monday. The new data revealed a troubling trend in nursing home settings. While nearly 78% of residents got at least one vaccine dose, only 38% of staff members got vaccinated, which suggests barriers to vaccination for staff that need to be overcome, according to the CDC. The racial breakdown of who got vaccinated is less clear. Since multiple jurisdictions aren't reporting a breakdown by race, there's missing data on about half of the people who were vaccinated. Based on the data that's currently available, 60% of those people who received vaccines were white, 12% were Hispanic and 5% were black, the CDC reported. As the vaccination rollout continues, it is critical to ensure efficient and equitable administration to persons in each successive vaccine priority category, especially those at highest risk for infection and severe health outcomes, the CDC said. More than 6 million newly diagnosed U.S. cases in January. 1 in 12 Americans have now tested positive. January marked the nation's deadliest month of the coronavirus pandemic, with a death total approximately 4 times the reported number of COVID-19 deaths recorded by the U.S. in any month between June and October 2020. According to an ABC News analysis of data compiled by the COVID Tracking Project, a volunteer-run effort to track the U.S. outbreak. In total, the virus has claimed the lives of over 440,000 people in the U.S., which translates to about 1 in every 747 Americans, according to an ABC News analysis of data collected by Johns Hopkins University. The U.S. death toll is approximately 147 times the total lives lost during the terrorist attacks on September 11, 2001, and is around 65% of the total number of deaths that were recorded nationwide during the 1918 influenza pandemic. Although the country's 7-day average of daily COVID-19 deaths appears to be plateauing, the U.S. is still reporting an average of just over 3,100 new deaths from the disease per day. According to the COVID Tracking Project data, more than 6 million COVID-19 infections were diagnosed nationwide during the month of January. making it the country's second worst month of the pandemic in terms of confirmed cases, data shows. Over the weekend, the country's cumulative tally of confirmed cases surpassed 26 million, which signifies that 1 in every 12 Americans has now tested positive for COVID-19. However, the national 7-day average of daily COVID-19 cases has dropped by 32.3%, the lowest average the country has seen since mid-November, according to the COVID tracking project data. COVID-19 hospitalizations also continued to decline rapidly across the country. The number of COVID-19 patients currently hospitalized nationwide is the lowest since late November. In total, more than 800,000 people have been hospitalized with COVID-19 in the U.S. since the start of the pandemic, according to the COVID tracking project data. SpaceX to launch all civilian crew to space, and one seat is up for grabs. SpaceX announced Monday it will launch the first mission to space with an all-civilian crew, and members of the public have been invited to enter a drawing for one of the seats on the spacecraft. The 4-person mission will be commanded by Jared Isaacman, a tech entrepreneur and pilot on the side. Isaacman is the founder and CEO of Shift4 Payments, a payment processing firm, and will be bankrolling the mission that has been named Inspiration 4. More. Corporate spaceflight lifts off in 2020. The major missions over the past year. Isaacman donated 2 seats to St. Jude Children's Research Hospital, one of which will be taken up by a worker from the nonprofit hospital. The other seat will be given to a member of the public who enters a raffle online. While no donation is necessary to enter the drawing, people are encouraged to donate to St. Jude's and can earn more entries by doing so. To kick off the donations, Isaacman committed an initial gift of $100 million. The 4th seat will go to an entrepreneur who uses Isaacman's Shift4 Shop e-commerce platform and submits a video showcasing their business and how they use the technology. This winner will be selected by an independent panel of judges. Inspiration 4 is the realization of a lifelong dream and a step towards a future in which anyone can venture out and explore the stars, Isaacman said in a statement. I appreciate the tremendous responsibility that comes with commanding this mission, and I want to use this historic moment to inspire humanity while helping to tackle childhood cancer here on Earth. More. NASA will pay a firm $1 to go to the moon and get a sample. The crew will undergo astronaut training conducted by SpaceX, and the launch is currently scheduled for no earlier than the 4th quarter of this year, according to a statement on SpaceX's website. The mission will use a SpaceX Falcon 9 rocket and its Dragon spacecraft and will launch from NASA's Kennedy Space Center in Florida. It will be a multi-day journey, SpaceX stated, orbiting Earth every 90 minutes along a customized flight path, and will be carefully monitored at every step by SpaceX Mission Control. At its conclusion, the Dragon spacecraft will splash down in a soft water landing off the coast of Florida. More. 4 astronauts launch for ISS in historic NASA SpaceX mission, and 30-second ad for the mission is slated to run during the Super Bowl this year to introduce it to the public. Today's announcement is the first step of a very exciting journey, Isaacman said. In the lead up to launch, we'll share new ways to support and follow our mission preparation and execution with a focus on inspiring and helping others. While it once took the backing of entire nations to get to space, the landscape has notably evolved in recent years to become the arena of billionaires with the rise of private firms such as Elon Musk's SpaceX, Jeff Bezos' Blue Origin, and Richard Branson's Virgin Galactic. Last year, SpaceX made history by becoming the first private firm to launch NASA astronauts into space, a feat it completed twice in 2020. Yale is offering its highly popular happiness course to high school students for free, CNN, in order to help young people combat the growing mental health crisis brought on by the pandemic. Yale University is now offering a variation of its most popular online course to more than 500 low-income high school students across the U.S. at no cost. Yale psychology professor Laurie Santos created the online course called The Science of Well-Being in 2018. It was introduced the same year as her in-person version of the course, Psychology and the Good Life, which attracted more than 1,200 undergraduates, or about 1 in 4 students on campus, in its first semester, according to a statement released by Yale. Santos, who lived among students as the head of Yale's Silliman College, said the idea for the course came to her after she saw firsthand the growing levels of depression and anxiety her students were experiencing. This is a really challenging time, and that means that students need to learn new strategies to protect their mental health, Santos said in the release. Our goal is to equip students with scientifically validated strategies for living a more satisfying life, while also creating opportunities for high-striving low-income students and students of color to demonstrate college readiness. The course, which was developed in partnership with the University of Connecticut and the National Education Equity Lab with support from the Arthur M. Blank Foundation, will present students with scientifically validated strategies for living a more satisfying life and examine what psychological science shows about how to be happier, how to feel less stressed, and how to flourish more, according to the university. The first half of the course offers students insights from psychology and neuroscience about what drives happiness. The second half of the course involves behavior change exercises designed to help rewire the brain. In March of last year, Yale began offering the online version, The Science of Well-Being, to the public free of charge on Coursera. To date, more than 3 million people have enrolled in the course. Now, Santos is bringing the program to the classrooms of more than 40 schools from 17 cities starting on February 2. The online course being offered to high school students, which Yale did not release a name for, will be slightly modified from the original. In addition to receiving access to the full course, students will also be supported by both a local teacher at their high school and a Yale teaching fellow. The news comes as many across the U.S. continue to struggle with their mental health. During the COVID-19 pandemic, 1 in 6 Americans has started therapy for the first time, and nearly 90% of people in the U.S. are experiencing one or more depressive symptoms, according to Vita Health and CNN. You'll need reservations to see Firefall at Yosemite this year, and they're going fast. CNN. Orange is always the most popular color at Yosemite National Park in California in February. That's when sun and water come together to put on that glorious show known as Firefall. But if you want to travel there and see it in person in 2021, you'll have to act fast. Because of the COVID-19 pandemic, a reservations system is in place. You can click here to access online reservations. Starting February 8th, you'll need to be set up with a reservation to drive into the popular park. Firefall happens at Horsedale Fall, which flows over the eastern edge of El Capitan in Yosemite Valley. According to the National Park Service, it's a small waterfall, and it normally flows only during winter. The Park Service said it's actually easy to miss related content the best lakes in California, but on some days during mid to late February, it might glow an enchanting and magical orange when it's backlit by sunset. The expected viewing dates for 2021 are February 13th to 25. The Park Service says the dazzling effect happens only on evenings with a clear sky when the waterfall is flowing. Even some haze or a bit of cloudiness can ruin the effect. Mother Nature provides no guarantees. It's about a 1.5-mile walk each way from the closest parking to the viewpoint near the El Capitan picnic area.